Can you see
All right,
me?
yes. Atom, I can see you now.
Okay.
Thank you. So Baba is
His
coming up.
Excellency will join you very shortly.
Thank you, Atom. Anyone from Proforama's office? Is Proforama's office, is Proforama online? Someone from his office?
Hello.
Yes.
Can you hear me, ma'am? Madam
Who is speaking?
Herrera from Cuba. From
Oh,
Havana.
hello. Hello. Thank you for joining us, Professor Doctor. How are you?
Fine, and you?
We can hear you. We can hear you clearly. Thank you for joining us.
It's a pleasure.
Good afternoon, everyone. I think everyone is online by now. Can I ask the panelists to please put their cameras on so that we can see them? Dr. Ahmed Ogwel Umma, Deputy Director of the African Center for Disease Control and Prevention. Welcome, my brother. Thank you for joining us. Her Excellency, Dr. Monique Nsanza Bangwanwa, Deputy Chairperson of the African Union Commission. Can you please put your camera on, Madam? Thank you, Madam, for joining us, and welcome to Addis Ababa. We're proud of your elections.
Thank you. Thank you.
Thank you, my sister. Prof. Benedict Orama, President of the Africa Export-Import Bank and Chairman of the Board of Trustees for the AU COVID-19 Response Fund. Welcome, sir. Can you please put your camera on? It's time for us to start the meeting. Good afternoon, everyone. Thank you for joining us while we're waiting for other panelists to join and put on their mics and their cameras. I am Suad Aden Osman. I work for CoDA. CoDA is a coalition, stands for the Coalition for Dialogue on Africa. It's a platform for dialogue and debate that has been set up more than a decade ago and currently operates as a special initiative of the African Union, African Development Bank, Afrexim Bank, and the UN Economic Commission for Africa. As I said, it's a platform for dialogue and debate that was set up based on to fill the gap that most of us feel at the questions that are treating matters that are of importance to the continent and its people are mainly engaging, and those who engage are mainly policymakers and diplomats. The remaining of the stakeholders were supposed to be also offered a structured way to engage in policy making on the continent at regional level. And that's what CoDA endeavors to do. It accompanies, furthers, and positions African Union leadership in providing solutions for African problems. I am pleased to welcome His Excellency Olusegun Obasanjo, my boss, the Chair of the Board of CoDA, former President of the Republic of Nigeria. We will also hear Professor Benedict Orama. Thank you for joining us, sir. President and Chairman of the Board of Trustees of Afreximbank and Chairman of the Board of Trustees of the AU COVID-19 Response Fund. We have with us Her Excellency Dr. Monique Nsanza Bangwana, Deputy Chairperson of the African Union Commission, newly elected. She's new, she's coming with us. She's joining the team. Welcome, Madam. We're proud of your elections. Thank you for joining us. We have Dr. Ahmed Ogwel Uma, Deputy Director, Africa Center for Disease Control and Prevention, Africa CDC. Dr. Ahmed, thank you for making time of your very heavy schedule and hectic working hours for joining us for this session and the coming ones this afternoon. This dialogue is the first dialogue of the Coalition for Dialogue in Africa in 2021. We usually hold the 2 dialogues. And as you can imagine, since we are in the middle of a pandemic, this dialogue is on Africa's response to COVID-19 and equitable access to vaccines and vaccination. Since the whole session is going to be for over a little less, hopefully 2 hours, it's my utmost pleasure to welcome my brother Ahmed Ogwel to also present and welcome the participants, since this has been jointly organized with Africa CDC, Africa Development Bank, Afreximbank, and the African Union Economic and Social Council. Dr. Ahmed, you have the floor.
No, thank you very much, Suad, and I am taking the floor on behalf of John Kangasong, the Director of Africa CDC, who would have been here to offer these welcoming remarks, but due to some unavoidable circumstances, he could not be able to join us today. So please do accept his apologies in that regard. First is to welcome everybody, all the panelists, the moderators, organizers, and especially participants who have joined us for this first dialogue, and to say that we appreciate your time. We also know that these are very difficult, it's a difficult season for everybody, and for you to make time to join us in this dialogue, we really do appreciate that. A dialogue is really very important, and beyond your immediate circle, when you start dialoguing with people from various sectors, people from various shades of thought, people from various communities, it is extremely important that we continue this principle of dialoguing across, not just to dialogue within the same group. So for us, it is very important that today we are dialoguing beyond public health. We are dialoguing beyond those who are every day engaged in COVID-19 response. And we would really like to hear from the rest of Africa and friends of Africa in this session today and tomorrow. As Africa CDC, we are very honored that we are at the center of this response, not just here at the African Union Commission, but also on the continent as well. And this because one of our mandates is really to coordinate the response to all health security issues like COVID-19, Ebola, and other outbreaks on the continent. So we are really honored that we have the mandate to be able to coordinate this response on the continent. Thirdly is to say that there is strength in trusted partnerships. And through these dialogues, we are able to engage with all types of partners, building trust amongst ourselves so that we can be able to appreciate everybody's strength and use that strength to be able to respond and to prepare and respond even better to not just COVID, but any other outbreak that may be able to come in the future. And we, as Africa CDC, are very confident that sessions like these are going to make all our work a lot easier, because we will be sharing information, we'll be sharing our thoughts, we'll be sharing ideas, and we'll be sharing our time as well. We welcome all institutions, we welcome all stakeholders in Africa and those who have an interest in working with us in Africa to join us in effectively preparing and responding. We are shifting a little bit our response to COVID-19 by going into vaccines, acquisition, vaccine, delivery, and vaccination itself. And therefore, we really are welcoming all institutions, organizations to join us in ensuring that all this becomes a success on the continent. So again, on behalf of Africa CDC, I would like to welcome all of us to this first day, this first session of the dialogue, and we are looking forward to a very good outcome that is going to help us on the continent to control COVID-19 and any other security challenge that may come our way. Thank you. Back to you, Swat.
Thank you very much, Dr. Ahmed. And indeed, you will be able to make the presentation. Africa CDC is the reason why we have not felt in this finding ourselves in the very famous awkward position we usually find ourselves standing in front of a whiteboard. Africa CDC stepped in and did what it needed to do. The coordinated response from Africa is widely recognized as being one that was coordinated and organized in the early stages because of the center. Thank you, Ahmed. You will have time to get into the details of what Africa CDC has been doing, and we are really appreciative of that. It is now my pleasure to welcome the Deputy Chairperson of the African Union Commission, Her Excellency Sanza Baganwa. Madam, you have the floor.
Good afternoon. Greetings, everyone. Your Excellency, President Olusegun Obasanjo, greetings. It's a pleasure to see you again. And in this new capacity I am in as the Deputy Chairperson of the African Union Commission, and one of the members of your board. We are happy to be here and to engage in this dialogue. And it's my pleasure to address this August gathering today as part of efforts to find solutions to the ongoing COVID-19 pandemic and other public health issues affecting our great continent.
Bishop Shihane, can you please mute yourself? Thank you. Sorry, madam.
Okay.
Greetings, Bishop.
Hello.
You may wish to go on mute. Thank you so much.
Sure.
This is indeed a very challenging time for all of us on African continent. And I can imagine also it's going to be equally challenging for a new deputy chairperson of the African Union Commission I am. But it's also a pleasure to be joining these CoDA dialogues where I think we are going to get ideas, insights, and also support some of the initiatives that have been going on. No one is ever fully prepared for a pandemic or any other disaster, but the ability to respond promptly and appropriately using existing mechanisms is highly essential to minimize casualties. And since the COVID-19 pandemic, the African Union has provided the leadership and coordination needed for a continental response through its organs, its departments, and agencies. And several initiatives are currently being implemented to support member states. These include sourcing and distribution of test kits and other medical equipments, the deployment of rapid responders and community workers, training, and other forms of capacity support. And currently, the African Union is supporting the procurement and distribution of vaccines through the African Vaccine Acquisition Task Team to member states to help in vaccinating their citizens against the virus. For sure, a lot has been done, but a lot more remains. And our efforts have helped minimize casualties and kept infection rates low, but we need to do more to put an end to this pandemic as soon as possible so that we can focus on our developmental agenda. And one way to do this is to secure more vaccines and ensure access to vaccines by everyone who needs them in a more equitable and inclusive manner. I'm delighted to see that the Coalition for Dialogue on Africa is doing something in this aspect by bringing together multidisciplinary team of experts to discuss further actions that will enable Africa to advance in its efforts to stop the spread of this pandemic. And the African Union Commission welcomes this initiative by CoDA to help expand the scope of its response across the continent. I commend the courage of the board and management of CoDA for this excellent initiative and call on other African organizations to emulate this and mobilize the needed support that will allow the African Union to extend the reach of its response efforts. Africa's solutions lie in Africa, and we are always encouraged when we see African organizations steering the wheel of actions in finding answers to the diverse needs of the continent. As the continental organization responsible for the welfare of the population living in Africa, I assure you that the African Union and the African Union Commission in particular will do all it can to support implementation of key recommendations and resolutions that are going to emerge from this dialogue. I thank you so much for your kind attention. I thank you for welcoming me to this dialogue, my first, and I wish this dialogue fruitful deliberations. Thank you.
Thank you very much, Madam. Thank you. You are the newest board member of CoDA by definition. The deputy chairperson of CoDA is the member of the board of CoDA. So thank you very much for being supportive of what we are doing. And this is going to be the first one, but among many, we're going to call on you. As you said, any potential avenue for ensuring that everyone, no matter where they live on this continent, has access to high quality healthcare is actually all of a sudden became the business of everyone. And as my brother Ahmed was saying earlier, Africa CDC has the mandate to do it. We are in a support capacity, and we will be accompanying them depending on how they feel it's fair and valid and relevant for us to step in. CoDA, as you know, is a platform for former heads of state, former prime ministers and ministers, and everyone's heart is at making sure that this pandemic ends the soonest we can on this continent. Thank you very much. I would like to welcome another son of the continent, Professor Benedict Orama, President and Chairman of the Board of Trustees of Afrexim Bank and Chairman of the Board of Trustees of the AU COVID-19 response, whose work is interestingly followed very closely by the stakeholders that CoDA actually entertains. Prof. Orama, you have the floor, sir.
Yeah, thank you, Sister. Your Excellency, Chief Olusegun Obasanjo, former President of Nigeria and Chair of the CoDA Board of Directors, Sister, Your Excellency, Dr. Monique Sazabanganwa, Deputy Chairperson of the African Union Commission. Let me take the opportunity to tell you and wish you again all the best in your new role. Congratulations. Your Excellency, Dr. Kengason, the Director of Africa CDC, represented by our brother, Dr. Ahmed, our sister, Bisaud Usman, Executive Director of CoDA, fellow CoDA board members, the clergy here with us, distinguished guests, ladies and gentlemen. Permit me to begin by expressing my appreciation to the chairperson of CoDA, Baba, for the opportunity to make remarks at this virtual dialogue series. Afrexim Bank is proud to be a co-organizer of this event, along with CoDA, the African Union, the African Development Bank, Africa CDC, and the Economic, Social, and Cultural Council. With over 4.4 million infections and 117,000 deaths, as at 15th of April, the COVID-19 pandemic remains a significant public health concern for Africa. The dual public health and economic shock threatens to disrupt Africa's growth prospects and years of economic progress. Already, African economies are estimated to have contracted by 2.1% in 2020, the continent's first recession in 25 years. Africa's trade is also contracted by about 12%, reversing the strong growth the continent achieved over the past 2 decades. The long-term socioeconomic impacts of the pandemic are also likely to be extremely severe and protracted for African economies unless the spread of the virus is contained. With the virus maintaining its spread, propagation, and mutation, experts say that the best approach to effectively overcome the challenges lies in the widespread production, distribution, and administration of affordable vaccines. However, and despite that Africa accounts for about 14% of the world's population, and being the region that is disproportionately affected by infectious diseases, Africa accounts for less than 0.1% of the world's vaccine production capacity. As a result, history is repeating itself as the struggle for access to the COVID-19 vaccine rages. With very limited vaccine production capacities and with vaccine nationalism everywhere, Africa faces an uphill task in bringing the virus under control and regaining control of its economies. Most African states will face a tough time in securing COVID-19 vaccines during much of 2021 and even 2022 because of production constraints, export restrictions, vaccine nationalism, vaccine diplomacy, and refusal by vaccine manufacturers to share intellectual property rights that can expand production worldwide. Most countries in Africa are relying upon the goodwill of the international community, especially through the Gavi COVAX facility, which is the COVID-19 vaccine sharing platform. However, thanks to vaccine nationalism and export restrictions, the timeline and scale of delivery of existing arrangements is highly uncertain, threatening vaccination programs across the continent. It is no wonder that while the UK, Europe, and the US are well near vaccinating 30% of their populations, Africa is yet to vaccinate 1% of its people. The evolving situation is likely to create a vaccination-linked development gulf that will further exacerbate global income inequalities and challenge the attainment of the Sustainable Development Goals and AU's Agenda 2063. Your Excellency, distinguished ladies and gentlemen, as an institution that has been from the beginning at the forefront of the struggle to help the continent contain the health and economic impact of the pandemic, we saw firsthand the weaknesses and severe vulnerabilities of Africa. The risk of overdependence on global supply chains for the simplest of healthcare supplies crystallized in very dramatic ways. From personal protective equipment to test kits, from therapeutics to vaccines, Africa was never in control of critical anti-COVID-19 supplies. It dawned on us that in times of emergency, in times of crisis, we can have all the money in the world and still be poor if you have nothing to buy with the money. I personally found that it is not always true that everything has a price. There are some times where you cannot buy, even with all the money you have. While the pandemic is tragic, it can be instructive and has provided an opportunity for Africa to take its destiny in its own hands. The pandemic has demonstrated what Africa is able to achieve when we come together and support our institutions. The proactive measures launched by the African Union significantly contributed to mitigating the health impact of the pandemic. Sizable financial and in-kind resources were mobilized through the AU COVID-19 Response Fund and Africa CDC. Our President Bank also collaborated with Mr. Strive Masiyiwa, AU Special Envoy, Africa CDC, and the UN Economic Commission for Africa to set up and operate the African Medical Supplies Platform, a digital platform that is being used to facilitate food procurement and equitable and fair distribution of COVID-19 supplies, including the vaccines we recently secured. It also created market access opportunities for African manufacturers of medical supplies. His Excellency, Mr. Cyril Ramaphosa, President of South Africa, and then Chair of the African Union, established the African Vaccine Acquisition Task Team, tasked with procuring vaccines, arranging the financing, and distributing the vaccine on a pooled whole of Africa basis. Due to extreme vaccine nationalism prevailing worldwide, the Africa Vaccine Acquisition Task Team worked with our President Bank to arrange the $2 billion financing needed and facilitated access to up to 400 million doses of vaccines for Africa, a large proportion of which will be manufactured in Africa at Aspen Pharma in South Africa. The vaccines will be distributed through the Africa Medical Supplies Platform. This financing complements the amount of $6.5 billion disbursed by our President Bank to support the COVID-19 pandemic containment on the continent during 2020. And while this response is critical given the current crisis, it is imperative that we work towards accelerating the implementation of the AU's Africa vaccine strategy and ensure that these vaccines reach all our communities. We therefore welcome this dialogue as an opportunity to collectively articulate and support the African CDC vaccine strategy. We welcome the engagement of faith leaders, youth, and the range of stakeholders brought together under this dialogue, and look forward to fruitful deliberations and constructive and insightful exchanges as we work collectively to stem the tide against the pandemic. And before I close, I must call on all of us, to also deliberate on key issues that we should draw global attention to. Today, there are various vaccines produced and being used around the world. Some countries have openly said that travels to their territories must be on the basis of a valid vaccine certificate. The question is, who determines an acceptable vaccine when vaccine approval regimes are disharmonious? We should push for mutual recognition of vaccine certificates and standardization of certifications to ease global travel and support tourism-dependent economies. Africa has so many such economies. We should also add our voice to those requesting the members of the WTO to reach an early and mutually acceptable resolution of the proposal on the temporary TRIPS agreement waiver to expand COVID-19 vaccine manufacturing capacities and help bring this pandemic under control. I thank you again for the kind attention.
Thank you very much, Professor. Thank you for the update on how the African response from top to the technician, as Ahmed quickly alluded to, and we'll probably get into the details of it, is being constructed under the leadership of our of the African Union heads of state and governments. Thank you also, Professor, for basically telling us how the legitimacy and the shared commitment of the institutions and the people of Africa who are seeking solutions to these problems are supposed to be constructed. We are many, and we are seeing how the multilateral system that has entertained so far very severe doubts in Africa's ability and desire to do something for itself, so that we can deal with the issues that we are facing, as is currently stuck. It became clear to all of us that we have been cooperating, not because we chose to cooperate, but because we were put in a situation where we had to cooperate. Thank you, Professor. And we are very many following the steps that you and your institutions are following to make sure that we really take African solutions, homegrown solutions, from pilot and project level to fully large deployments on the continent, so that if the economics of service delivery are supposed to make sense, we're really happy to see the steps that Afreximbank is taking. Without further ado, we would want to open this dialogue and debate the way we usually do it, and that is to allow Baba, the chair of the board of CoDA, former president of the Republic of Nigeria, to deliver his opening remarks. Baba, you have the floor.
Can you hear me?
We do, Baba. We hear you loud and clear. Go ahead, Baba.
Okay. Swat, thank you very much. And let me start by acknowledging the presence of my sister, Dr. Monique, the Deputy Chairperson of African Union Commission. And sister, let me also congratulate you for your appointment. We are all looking forward to working with you in your new assignment. Let me also appreciate the Director of Africa CDC for the work that organization is doing, and for what has been presented this afternoon on behalf of the organization. And let me welcome and thank the President and Chairman, Board of Trustees of African Bank, my brother, Professor Benedict Orama, and for taking us through where we are, particularly in the area of vaccines. Let me welcome all of you participants who will be participating in this dialogue for today and tomorrow. For more than 1 year, the world has been under the siege of the COVID-19 pandemic, and the pandemic has not shown any sign of abating despite efforts by healthcare workers and authorities all over the world. We see the number of cases increase every day in other parts of the world, and in Africa, as in other parts of the world, we have witnessed the first and second waves, and some countries are even witnessing a third wave already. Many lives have been lost, and many families and businesses have been affected because of the associated lockdowns and restrictions. Jobs have been lost, and many have been made poor. This is most unexpected and, of course, most undesirable. But shall we continue to live with this pandemic? No, I will say. The current situation only tells us that we need to do more to get us out of the woods, and that we need more involvement by the different sectors of the society to get the pandemic under control and to be able to resume our normal lives and activities. This is the reason governments, international organizations, the private sector, and individuals are working hard to find lasting solutions to the pandemic and the problems it has brought in its wake on the world. In Africa, we are doing a lot to find an end to the pandemic. Our governments have been overstretched, and our healthcare facilities and communities are feeling the impact of this deadly and dreadful pandemic. The response of our healthcare workers under the leadership of global, continental, and regional organizations have been awesome and beyond expectation. I would like at this time to acknowledge their sacrifice, their sacrificial service and efforts to keep our continent safe. I commend the leadership role played by the African Union through the several of its organs, and particularly the African CDC. And these efforts have helped Africa to prevent a major catastrophe due to the pandemic. I also acknowledge our global coordinating mechanisms under the leadership of the World Health Organization. Their efforts have given us hope of seeing an end to the pandemic. We are all aware of how much this pandemic has disrupted lives of our population socially, economically, and politically. And this is the reason the Coalition for Dialogue on Africa, CoDA, is stepping in to support Africa CDC in making safe and efficient vaccines available and accessible across Africa. With this dialogue and other follow-up activities, CoDA is supporting implementation of some aspects of Africa's vaccine development and access strategy, which was developed in June last year, and other aspects of the response as necessary. Through its networks, CoDA is reaching out to a wider stream of stakeholders and partners to help increase commitments to make the vaccines available in cities, villages, and communities across Africa. We need to get a continental herd immunity through vaccination. Beyond COVID-19, Africa needs a forward-looking roadmap for addressing the shortcomings we have witnessed in Africa's response to the COVID-19 pandemic, to make sure that future pandemics do not meet us unawares and unprepared, as did the current pandemic. Africa needs a more sustainable approach to addressing the challenges associated with accessing vaccines and other services for public health emergencies. And this is an area that CoDA intends to provide some support. We need to come together for vaccine purchase to get advantage of economy of scale, and for vaccine research and production. In partnership with the College of Medicine Sciences, of Medical Sciences of the Benedict University here in Nigeria, researchers, scientists, academia, international partners, and the private sector, we are initiating a new program that will support and strengthen our government's efforts to make vaccines and vaccinations accessible to everyone who needs it across the continent now and in future. I commend the effort of those who have been involved in organizing this dialogue, the panelists, as well as the participants. And I am personally delighted to be a part of these efforts to find solutions to Africa's most pertinent problem at this particular time. I personally look forward to seeing the outcome of this dialogue and the follow-up actions, and will provide every support needed to ensure full implementation through CoDA and all the organizations that form CoDA. The UN ECA, the Africa Development Bank, the AU Commission, and the African Bank. I thank you all for being part of this historical event.
Thank you very much, Baba. Thank you for reminding us that it is the mandate of CoDA to bring the other African stakeholders' view into intergovernmental processes. As my brother Prof. Oramas clarified earlier, we will not be able to implement anything that will be of significance to our people until we unleash all the support we can get from Africans of all walks of life, private sector. The private sector and private universities on the continent have a lot to offer. Many Africans, individuals and institutions have lessons to offer to the world. Technology is ready. We need to leapfrog our developments. Regulation and sharing of data is where we have gaps and they need to catch up. Thank you, Baba, for reminding what CoDA can do and is willing to do to support African Union leadership in proposing African homegrown solutions to our own problems. This brings to an end the opening session of this dialogue. I would like to introduce the next moderator, Professor Arthur Mutambara, former Deputy Prime Minister of Zimbabwe, Professor of Robotics, who focuses on the opportunities and challenges of the fourth industrial revolution in Africa. But to CoDA, he is a son of Africa who is extensively involved in socio-economic and political issues globally. Professor, you have the floor. It's over to you now. Thank you, Professor. And before I give you the floor, there is only one question in the Q&A. I think that if and when you find a moment, it could be something you will help us find a response to. Over to you, Professor. Thank you.
Thank you very much. As I introduce this panel, let me make a few remarks. It is imperative that Africans have agency in all matters of public health. We must not be subjects. We must be participants. We must be in charge of our public health. We are not a case for charity or benevolence. We cannot just be a market for vaccines whose content, efficacy, and safety we have no knowledge about. We must make sure from now on, we are masters of our own destiny in terms of public health. We might not have done it this time around with COVID, but we must build out of our capacity so that for future pandemics, Africans must be in charge of their lives and their public health. You know, the COVID-19 and vaccines, it's not just about health, it's about economics. The producer companies and producer nations are making tons and tons of money from vaccines. The African must be a player in that economy of vaccines. The African must benefit from the economics of producing vaccines. We want Africans to be participants in the entire value chain of vaccine development, vaccine production, and also in the commercial aspects of vaccine production. Why should the global north make all the money out of vaccines and not Africans? Going forward, we want the Africans to be participants, not only as a market, but as a producer of vaccines. Africans must take charge of their public health security. Our public health security cannot be outsourced to external players. We need to challenge the global public health order. Don't assume that the current global public health order is in our favor. No, We must reorganize it, we must redefine it in terms of our wants and our needs as Africans. In other words, African agency should be at the center of how Africans participate in addressing COVID-19 and future pandemics. In doing this, let us work as integrated Africa, united Africa, a continent which is united, which leverages economies of scale and not fragmented and divided nation states. We must talk about Africa as the center of our discussion, not the state, but the continent. So it is important as we do this to realize that the only way we can make a difference, the only way we can move forward and be producers of vaccines is when we work as a continent, not as Gambia, Nigeria, or South Africa, but as the African continent, united and integrated, economies of scale. Now, to do all this, we require leadership. What do we mean by leadership? Leadership is not only governmental leadership. Leadership is not only presidential leadership. Leadership is not only at cabinet level. Leadership is not only in parliament. There's traditional leadership. There's religious leadership. Faith and traditional leaders have a role to play in this response to COVID-19. If we're going to build confidence around the African response to COVID-19, we must create buy-in and ownership by traditional leaders, buy-in and ownership by our faith leaders. This is why this session is very important. We are talking about how we bring on board, how do we create agency among our traditional leaders, among our faith leaders. So today we have three leaders, traditional leaders, faith leaders, who are going to share with us. The first one is the son of the soil, a Sama of Benin Kingdom, Chief Gabriel Ignedion. He is a distinguished businessman, a distinguished entrepreneur, and also a creator of academic institutions. He is the creator of the first private university in Nigeria. He is an outstanding philanthropist. And today he's concerned about the agenda around COVID. He inspires us as the people of Africa. He continues to inspire us as he puts his head to the work around COVID-19. So with these few words, I want to bring up into the conversation Chief Gabriel. Tell us, talk to us as our traditional leader. Talk to us as our business leader. Talk to us as our political leader, what we can do as Africans to generate confidence, to generate solutions to this matter of COVID, and also how we can prepare for future pandemics. Chief Gabriel, the moment is yours.
Thank you. Well, Your Excellency, Chief Olusegun Obasanjo, former President of the Federal Republic of Nigeria, Professor Benedict Orama, President of African Export Bank, distinguished ladies and gentlemen, brothers and sisters from Africa. It is a great pleasure for me to deliver this message of goodwill as we engage on the very vital issue of Africa's response to ongoing COVID-19 pandemic and the equitable access to accepted vaccine and vaccination plan for Africa. I would like to thank the Coalition for Dialogue on Africa, the African Union, and all the co-organizers for inviting me to be a part of this important event. I particularly thank the African Center of Disease Control and Prevention for this committed to management of this pandemic on the continent. Despite the challenges of combating the spread of virus on the continent, where many countries lack the necessary infrastructure to aid their work, Africa's CDC has presented itself as the voice for all Africans. This dialogue is indeed very crucial one to hold at this time. You will agree with me that the conversation regarding the pandemic is all the cardinal vaccination of our citizens are being held at all levels. But many questions remain unanswered. African countries need more support messaging on this important of COVID-19 vaccinations. But beyond this, support must also be delivered to the continental effort to develop African vaccine. This epidemic has exposed many of these limitations on the continent, one of which is lack of infrastructure and facility for large-scale vaccine production for humans. The pandemic has also brought to light the commitment by Africa to seek solutions to these limitations. This event in the numerous engagement and agenda taking place across Africa currently. The success of this virus effort will help pave the way to develop, empower African youth in a post-pandemic world. We must therefore seek immediate implementable solutions that will help our young people to successfully adjust after the pandemic is managed. I wish you a successful deliberation, and please be assured of my continued support to the continental effort to achieve vaccine production on the continent and the vaccination for all Africans. Thank you.
Thank you, Chief Gabriel. Thank you for those words of wisdom. We must be motivated to produce our own vaccines. We cannot depend on others to take care of our public health. As Africans going forward, we must be consumers of what we produce. And in terms of vaccines, we must produce vaccines on the continent. Next, we have Bishop Chihane, who is the current bishop of the Maronite Catholic Eparchy in Cairo. He was born in Lebanon and studied at the Holy Spirit University of Kaslik. He was also confirmed as the Bishop of Cairo by His Holiness Pope Benedict. He is a leader, a faith leader, a religious leader in both Egypt and also Sudan. Bishop, can you talk to us? Can you share with us your views as our religious leader, as our traditional leader on the continent of Africa? Bishop Chihane, the moment is yours.
Oui, hello?
Bishop, you're on. You can go ahead, Bishop.
Yes, yes.
Yeah, go ahead.
Yes. OK, OK. Bonsoir à tout le monde. Alors, vous m'entendez?
Bishop, we can hear you. Go ahead, Bishop. We can hear you. Go ahead, Bishop.
OK, OK. Alors, je suis content d'être avec vous et de prendre la parole. Vous m'avez donné l'occasion de dire ma pensée et puis la pensée de l'Église catholique là où je suis membre de cette Église catholique. Je suis ici présent en Égypte. Alors, et puis, et comme je fais partie de l'Église catholique, bien sûr, je signale la position du pape François à propos du Covid-19 et puis la conférence des évêques catholiques au Canada que disent sur le vaccin et puis encore des pères jésuites qui sont en Afrique. Encore, qu'est-ce qu'ils ont dit à propos du vaccin? Et premièrement, je pourrais commencer pour vous dire que hier, pour vous encourager, pour encourager ceux qui nous entendent, j'ai eu un coup de téléphone du ministère de la Santé en Égypte en me disant que mon tour de prendre le vaccin, ce sera le 27 de ce mois avril. Alors, je dois partir pour prendre le vaccin. Et alors, et comme vous savez, et plusieurs sachent que le pape François a pris le vaccin et puis au début de l'année 2021 a commencé à dire que je crois que d'un point de vue éthique, tout le monde doit se faire vacciner. C'est un choix éthique parce qu'on met à risque sa santé, sa vie, mais aussi la vie des autres, a-t-il insisté. Encore, le pape continue à dire que je ne sais pas pourquoi quelqu'un dit non. Le vaccin est dangereux, mais si les médecins le présentent comme une chose qui peut être bien, qui ne présente pas de risque particulier, pourquoi ne pas le faire, s'interroge le pape François. Et comme j'ai dit que lui, le pape âgé de 84 ans, et encore le pape émérite Bénédicte Benoît XVI, 93 ans, est reclus dans son monastère au Vatican, ont été tous deux vaccinés contre la COVID-19. Encore le pape, dans un entretien télévisé, diffusé, a dit que avait qualifié l'opposition au vaccin de négationnisme suicidaire, mettant en exergue un choix éthique indispensable pour protéger la vie des autres. Il a donc concrètement donné l'exemple. Nous, dans nos églises, avec nos paroissiens, là où on se trouve, on encourage les gens pour prendre le vaccin parce que c'est une affaire morale. On ne peut pas rater cette chose, on ne peut pas le mettre à côté. Et alors, pour vous dire encore que les pères, les supérieurs majeurs des jésuites d'Afrique, qu'est-ce qu'ils ont dit? Joignent leur voix à celle du pape François et affirment la nécessité de rendre les vaccins COVID-19 disponibles et accessibles à tous. La conférence des Jésuites d'Afrique et de Madagascar s'est jointe à la position de l'Afrique du Sud et de l'Inde de suspendre temporairement les brevets et autres droits de propriété intellectuelle sur les médicaments, les tests de diagnostic et les vaccins destinés à la riposte contre la COVID-19. Après avoir lancé un appel au président américain Joe Biden, les jésuites africains ont écrit une lettre à l'ambassadeur allemand à Kenya pour demander à l'Allemagne et à l'Européenne de ne pas faire obstacle à cette initiative qui pourrait sauver des millions de vies et qui a été soutenue par une centaine de pays et plus de 400 organisations de la société civile dans le monde. Alors, le pape François insiste, les supérieurs majors des jésuites en Afrique encore insistent et cherchent de chercher le vaccin de partout dans le monde. Alors, et en plus, comme j'ai dit, la conférence des évêques catholiques du Canada encore encourage et a publié une brève note sur les préoccupations éthiques liées au vaccin COVID-19 actuellement approuvé. Alors, les évêques, la conférence des évêques catholiques du Canada disent que les catholiques sont invités à se faire vacciner conformément aux exigences de leur conscience et en contribuant au bien commun par la promotion de la santé et la sécurité d'autrui. Alors, c'est de prendre une précaution personnelle et puis encore pour ainsi sur la sécurité des autres, parce qu'on est responsable des autres encore. Une deuxième chose, la note de la conférence des évêques au Canada retient simplement la position du Saint-Siège et concernant l'utilisation des vaccins. Et tous les vaccins contre la COVID-19 qui ont été approuvés par les autorités sanitaires compétentes peuvent être licitement reçus par les catholiques. On ne peut pas dire on va prendre ce vaccin, ce nom de vaccin ou d'autres noms de vaccins parce qu'il y a il y a plusieurs prépositions, mais le vaccin est le même et il ne faut pas hésiter de le prendre. Puisqu'il y a encore une autre note, actuellement, aucun choix de vaccin offert, les catholiques peuvent, en toute bonne conscience, recevoir tout vaccin disponible et offert. D'ailleurs, il faut faire tout de notre mieux pour encourager les gens, ceux qui sont à notre responsabilité, ceux qui nous écoutent aujourd'hui pendant cette séance et demain. Alors, on devrait encourager, on devrait faire par tous les moyens pour aider, pour encourager, faire de notre mieux parce que on est encore responsable, même si on n'est pas médecin ou responsable, mais en tant que responsable spirituel, responsable de là où nous sommes, on devrait encourager les gens et faire de notre mieux pour aider chaque personne là où se trouve pour garder la vie, pour sauver la vie, notre vie et la vie des autres. Je vous remercie infiniment parce que vous m'avez permis de faire ce lancement, de dire la vie de notre Église, de certaines communautés, que ce soit au Canada, que ce soit en Afrique. Merci bien.
Thank you very much, Bishop. Thank you very much, Bishop. You've heard it, people. The church leader has spoken. The Catholic Church has spoken. The Pope has taken the vaccine. So the vaccines have gotten a vote of confidence from the Pope. We must take the vaccines. Not only that, the Pope has spoken against vaccine nationalism. The Pope is encouraging countries to share vaccines. The Pope is encouraging countries not to put profit before life. The issue of intellectual property rights, yes, must be respected, but life is more important than intellectual property rights. The Pope has spoken about the need to decentralize the certification of vaccines. Let us not wait for the FDA. Let us not wait for WHO. If a country does certification of a vaccine, let us go ahead and take that vaccine. That is the message coming from the church. That is the message coming from our church leaders. We move on to our next spiritual leader, our next faith leader. Sheikh Abdul Karim is a devoted Muslim leader from Kenya who is passionate about development issues in Africa and globally. He has facilitated several interfaith dialogues as well as activities to support peace building, leadership development, performance improvement, and quality management systems. He's a member of the Board of Trustees of the International Open University in Kenya. Here is the message from our Islamic brothers. Here is the message from our faith leader, Sheikh Abdul Karim. The moment is yours.
Thank you so much. Please accept my greetings of peace from the land of peace. I'm presently at the holy city of Mecca. So peace be upon you all in the month of Ramadan. Thank you so much. I just arrived the other day from Kenya. Let me go straight away. Even the Grand Imam of the great mosque of Mecca has also taken his vaccine. And that is very encouraging for everybody to emulate and follow good footsteps of our leaders. Among the concerns which religious and faith leaders have is the uncoordinated policies and protocols in Africa. A good example, you see that you travel to a country, especially during the first wave. One country asks for the COVID test, the other country doesn't. The other one, they're asking for specific tests which it is not recognized in another country, and so on and so forth. So we in Africa, we need to have coordinated policies and protocols whereby all countries follow unified protocols rather than having each country having their own protocols. Another very important issue is that inclusivity of religious leaders in policy making. Religious leaders as major stakeholders, since they have big followers, especially in Africa, therefore they are major stakeholders, and they should be included in policy making as well as protocol making, rather than impose on them, and then you find certain leaders defying those protocols. It's high time that we excel in science and technology, and not only excel in athletics, in mid and long distance running, but we need to lead from forward. And we are so much proud of CDC Africa and other stakeholders which are who are really working hard to look for solutions for Africa. The other very important issue is that we should not be over dependence on others. A good example would be India, for example. It manufactures vaccines for both local consumption as well as for export. But since they now have a surge and a rise in COVID-19 cases, then obviously they have to look after their own citizens before exporting to others. Therefore, this over-dependence of others keeps Africa in a tight situation. Since we don't have enough vaccines for everybody, we need to choose the most vulnerable amongst the society, e.g. the frontline medical personnel, people with underlying illnesses, and so on and so forth. Therefore, in other parts of the world, they are vaccinating their whole population, but we in Africa, we need, since we have limited number of vaccines to give to our people, then we need to choose the most vulnerable amongst us rather than vaccinating everybody. Also, some of the vaccines are not appropriate to African setup. For example, you have vaccines which require storage temperatures of -70, which because of infrastructure in Africa and other difficulties, it's not appropriate for us. So we need to have our own solutions. Just like Madam Dr. Monica rightly put it, that we need to look for our own solutions for our own challenges or problems. Therefore, we need to come together, we need to partner and come up with our own manufacturing factory for vaccine. And it's very much practical. If you look at it, they say that you need about $200 million to put up a vaccine manufacturing facility. But then we are spending so much more than that in buying. So rather than buying, if we can come together, put all our resources together and have our own manufacturing farm in vaccine. And not only, of course, limiting ourselves to COVID-19, but we can come up with other vaccines, for example, malaria vaccine and other vaccines, looking at what challenges we are facing for our people, and come up with our own solution rather than depending on others, and then they put prices which we cannot afford. They make vaccines which are not appropriate for our setup, and so on and so forth. The other most very important point is the use of technology. And a good example is right now we are communicating with people all the way, like Dr. Luis, all the way from Cuba. But we are all in one platform, and we have saved so much money in terms, and as well as time in terms of air tickets, in terms of accommodation, in terms of meals, logistics, and so on and so forth. We can use technology, and we should have frequent and more meetings, since we are consuming very little resources to come together, bring our heads together, look for our own solutions to our own problems. So we should partner, we should come together, and all stakeholders, both religious leaders, scientists, academicians, to fight a common enemy. Because of coming together, we could also dispel the many conspiracy theories which are around. And since religious leaders are in contact with the people on the ground, up to the village level, these theories, these misconceptions, these myths, they can easily be tackled by religious leaders after being fed with factual information from the scientists and from academicians. So if we can all come together, religious leaders, scientists, academicians, feed a proper factual information to the religious leaders, and then the religious leaders can repackage that information and pass it on to the communities, and therefore we won't have all these conspiracy theories about vaccines, and thereby our communities not wanting to take vaccines because of misinformation which is going around. For those remarks, thank you very much. I really appreciate everybody, and best regards from myself. Thank you so much.
Thank you very much, Sheikh. Thank you very much, Sheikh, for those words. Here we go again. We've gotten the confirmation. We also have the validation and vote of confidence from the Islamic leaders. They've taken the vaccines. Not only that, they're urging us to be united. They're pushing for an integrated and united approach to the COVID-19. The Africa approach must be what we push, not country approach, Africa approach. They are also emphasizing that we use economies of scale that come from unity. The religious leaders are major stakeholders. So the emphasis from the Sheikh is that please take into cognizance the importance of the religious leaders, because they have lots of followers and buy-in and ownership can be created through these leaders. There's also an emphasis on science and technology and the importance of African agency. Do not depend on foreigners. The Sheikh has told us to not depend on foreigners. Let us depend on ourselves. More importantly, let us work on our own solutions and make sure that the vaccines we produce are conducive for our environment. We are done with this session, and we're going to move on to the next one, which is chaired by Brian Kagoro. Brian Kagoro is the program director at Osisa Society Foundation. He's also a distinguished Pan-Africanist and a constitutional lawyer by training. He has been an active member of the African community and also has worked for the UNDP. So Brian Kagoro, I hand over to you to chair the next session. I thank you very much, everyone, for participating on session number 1. Now we go to session number 2, which is chaired by Brian Kagoro.
Thank you so much, Professor Mtambara. Excellencies, distinguished participants, all protocols observed. Chief Olusegun Obasanjo, former president of Nigeria and chair of CoDA, and the Bishop, Chief Gabriel Igbinedion, the Sama of Benin, as well as Sheikh Abdullah Karim. Thank you so much for that session. I have a distinguished set of participants. I'm going to truncate their CVs because there is a rule where the next set of speakers and I come from, which is called Africa, that if the introduction is too long, it means the substance is going to be short. So I'm going to keep the introduction short. Our presenter in this session, and you will allow me, I put a flag of a particular country there behind me, so that I could exercise a little bit of, strictness when it comes to time. Our main presenter is going to be Dr. Ahmed Ouma, who's the Deputy Director of Africa CDC. Dr. Ouma is, as you know, apart from his current role, he has a distinguished career as an international civil servant and an expert in global health. He has been a pioneer in supporting governments in Africa to implement the WHO framework, Convention on Tobacco Control, and other international instruments for the prevention and control of non-communicable diseases. He has occupied many distinguished positions, which I will not go into. The respondents are Ms. Atsuko Toda, who's the acting Vice President for Agriculture, Human and Social Development at the Africa Development Bank. She has a long career within international institutions. She joined the bank in 2016, and I've already indicated what her remit is. Between 2004 and 2012, she had several positions in different emerging countries of Asia, including Vietnam, Laos, Nepal. And in 2012, she moved to Africa as the IFAD country director for Nigeria country program. She has therefore managed various programs across the global south and also within the continent. Dr. Ahmed Mandari, who is the WHO regional director for the Eastern Mediterranean region, will be represented by Dr. Abdinessa Abubakar. Dr. Abubakar is a manager, infectious hazard management, Department of Emergencies at the WHO. And he also has a distinguished career working across the Mediterranean, Eastern Mediterranean region with more than 25 years experience, as I've said, in public health. We have distinguished panelists. Dr. Ahmed, you will forgive me. I will ask you to speak for 10 minutes. I will try not to interrupt. You will immediately be followed by Ms. Atsuko Toda, and then afterwards, I think Dr. Abubakar will come in. We're trying to save on time, but not to restrain the content of what you say. So I'm going to ask Dr. Ahmed to speak for about 10 minutes so that we have space for questions. Dr. Ahmed, I know you are our host, but thank you so much for accepting the direction from the moderator. It's not dictatorship, it's a friendly direction.
Thanks a lot, Brian, and good morning, good afternoon, good evening, colleagues, wherever you may be. To first send my greetings to His Excellency Chief Olusegun Obasanjo, the former President of the Federal Republic of Nigeria, who opened this dialogue for us. President Orama of Afrexim Bank, Dr. Monique, the Deputy Chairperson of the Africa Union Commission, the distinguished panel of the session that has just ended, His Excellency Chief Gabriel Ogbinedion of the Sama of Benin Kingdom, and Bishop George Shihane and Sheikh Abdul Latif Abdul Karim. Greetings and all protocols observed. Warm greetings from Addis Ababa. And if you allow me, I will share my screen so that I can speak for a few minutes in relation to what we as Africa CDC have been doing in as far as coordinated response on the continent is concerned. So let me start by saying that my presentation will be in 3 parts. I'll give an epidemiological update of where we are on the continent today, then go a little bit into our coordinated response, and then some key messages, and I'll try and keep it, Brian, under 10 minutes, considering that time is very short. First, as we speak today, the cases on the continent is just over 4.4 million people have been affected on the continent. We have unfortunately lost about 117,000 people. The graph there shows you the 7-day moving average. And you can see that sometime in July, we hit the peak of our first wave. Early in this year, around the middle of January, we hit the peak of the second wave. And right now, we can see the numbers in certain parts of the continent trying to go up, while certain parts of the continent are still under control. We have not yet hit a third wave, but some countries like Kenya, for example, are seeing their third wave, while some, like where I am in Ethiopia, are only seeing their second wave. So the picture is quite mixed on the continent. And you'll also see that each time there is a wave, the numbers are more, and not just the numbers of those infected, but also the numbers of those who are seriously ill and the numbers of those who are dying. And this is a very important motivation for us to start to ensure that we are not just observing the public health measures, but also getting vaccines being used to the population. If you look at the picture of Africa, literally everywhere, we have the virus has been documented. Again, you will see that some countries have larger numbers than others, but the general message here is that the whole of Africa is actually affected. Let me quickly shift to what we have done in as far as a response is concerned. The first case was documented in Africa on the 14th of February of last year in Egypt. And since that time, several things have happened. A lot, of course, has happened, but then several key things have happened. On literally 1 week after the first case was documented, His Excellency Musa Faki Mohammed, the chairperson of the Africa Union Commission, called the health ministers of Africa together on the 22nd of February so that we could get a policy direction at the ministerial level. And during that meeting on that day, a task force was set in place and a joint strategy, a joint continental strategy was as well proposed and endorsed. Down the line, about a month or so later, 2 months or so late, 1 month or so later, the Bureau of the Africa Union, which are heads of states that represent the 5 different regions, also met and not only endorsed the continental strategy, but also directed that we form the Africa Union COVID-19 Response Fund, which is chaired by Professor Orama, the president of the Afrexim Bank. And this was the beginning of the solidarity that we have seen work very well on the continent during this season of the COVID-19 pandemic. We've launched several initiatives. I'll not go through them, but of note is that we have been transitioning from just documenting the numbers on the continent to responding, and now we have reached that stage this month of talking about manufacture of COVID-19 vaccines. But this timeline shows you that key events have been happening throughout the time that COVID started on the continent. At this meeting on the 22nd of February, you see ministers of health there who really set us rolling in as far as response on the continent is concerned by adopting the Africa Joint Continental Strategy on COVID-19 outbreak. Since then, we have produced several policy documents, all geared at ensuring that our countries in Africa are working together, are synergizing their response, and are using guidelines and guidances that are similar across the continent. So far, we have produced about 30 different guidelines and guidance documents on different aspects of response on the continent. A very key initiative that was launched last year as well is the Partnership to Accelerate COVID-19 Testing in Africa. We call it PACT. And really its pillars were testing, tracing, and treating. And all those targets that you see on the screen there were met in good time to show you just how much the African continent came together in responding to this pandemic. Apart from providing guidance documents and hitting targets for testing, tracing, and treating, the Africa Union also came together with the AU special envoys. And of particular note here is Mr. Strive Masiwa, whose company helped to put up the Africa Medical Supplies platform This platform is where countries go to be able to access all COVID-19 related supplies, and you can be able to shop online literally. The pricing is pre-negotiated, the quality is pre-assessed, so anything and everything that is found on this platform comes with a very good solid seal of approval of from the technical side of Africa CDC, a very key initiative there to make our commodities more readily available. Diagnostics, laboratory diagnostics is a very key part. When we started the pandemic in January, no country in Africa, no laboratory in Africa had the capacity to be able to do diagnosis for COVID-19, the virus. But quickly in February, we started with two, one in South Africa, one in Senegal, and progressively we started training our laboratory scientists and providing them with test kits. And by the middle of the year, around May, we had more than 2/3 of the countries on the continent being able to do laboratory diagnosis for the COVID-19 virus. As we speak today, all countries can be able to do that. Just a snapshot here of the sorts of initiatives that we have gone through as Africa CDC to respond to this pandemic. We have put up 6, and I have left out all the initiatives that are related to vaccine and vaccine production, access, and procurement, because I will speak about that in the next session. But you will see that as the pandemic evolved, so did the different initiatives that Africa CDC and Africa Union were putting in place to be able to ensure that response on the continent is coordinated, response on the continent is effective, and the whole spirit of African solidarity came together very well in ensuring that the numbers remained low. In ending, Chair, I would like to pass these 4 messages to those who are with us here today. What we have learned, one is that we need to effectively coordinate our work in Africa. And we've been doing this at the highest level. The Africa Union Bureau of Heads of States have met more than 15 times to give us direction, to give us their vision of what we need to do on the continent. And this kind of coordination has also been seen amongst our ministers of the different aspects within our society: ministers of health, ministers of finance, ministers of transport, ministers of education, ministers of technology. We have seen a lot of coordination on the African continent, and this has provided a very solid synergy in the response that we have made on the continent. Secondly is that the vision that the Africa Union Heads of State had of a specialized agency for health security, Africa CDC, was an excellent investment. And at a time like this, if we did not have a specialized agency to be able to ensure that we are getting good commodities, we are developing good ways of responding to the pandemic, of generating good data and evidence, then things will have been very different, like we saw with the Ebola response in West Africa in 2014, 2016. So that investment in a specialized agency was an extremely excellent investment for the African continent. Third is that trusted partnerships give great benefit. We have seen many partners come onto the continent wanting to help, and we have ensured that they come in an organized way, and we have ensured that there's equity in the kind of support that is coming to reach each and every country on the continent. And we have also ensured that all the partnerships are to the benefit of Africa and African needs. Partnership, trusted partnership, has been extremely beneficial, and we will continue to ensure that it is so. And finally is that we need to invest in resilient health systems on the continent, because it's not only a benefit to the continent, but it is also very urgent that we have these resilient health systems. That way, anything coming after this pandemic, we can be able to handle it quickly, we can be able to handle it efficiently, and we can be able to handle it with good evidence that we are generating on a daily basis. Chair, I hope I've stuck to my 10 minutes, and I thank you all for giving me an ear and listening to that presentation. Thank you.
Daktari, you have put the clock to shame in how efficient you have handled it. Ms. Atsuko Toda, you've got 5 minutes to respond or to share your insights.
Thank you so much, Brian. And thank you so much, Dr. Ahmed, for the excellent presentation from Africa CDC. I could not agree more with regards to the presentation, but also the conclusions that you made. I'd like to thank the previous speakers in session. There's some very important concepts that are coming out: the political will on the African continent, the solidarity, the partnership, the fact that solutions have to come from within. There are champions bringing in the public and private sectors, and investment in an entire ecosystem, i.e. a healthcare defense system, so important. So I'd just like to raise, as the African Development Bank, we fully support this organization, this workshop, and thank you so much for putting this together. Africa faces 4 key challenges to mount this successful COVID-19 vaccination campaign. There are many good things that are happening, but to reach herd immunity of 60% to contain the pandemic, I think we've heard about the vaccinationalism, but also what's happening is there's a backdrop of emerging fiscal pressures for most countries on the continent, and taking into account the cost of available vaccine technologies on the market, affordability is an issue to achieve this herd immunity, hence the need to expand vaccination coverage beyond the current target of 20%. 2, there's also an issue of logistical readiness to receive, transport, and administer COVID-19 vaccines. And that's why the ecosystem is so important. It's also an issue of infrastructure. AstraZeneca and Johnson & Johnson are the most suitable for the majority of low-income African countries in terms of cost and cold chain requirements, but having an array of options is very important, and those require different infrastructure. Thirdly, I think with regards to the leaders who have spoken, the vaccine take-up hesitancy has been a challenge, but with leaders who are promoting, we hope that the overall vaccine uptake in Africa will start to increase. With regards to some of the solutions, we believe that improvements are needed to ensure adequate vaccine supply to meet the forecasted shipments, i.e. more recently, the halt of India's exportation of AstraZeneca vaccine to Africa paints a picture which is challenging. Africa is affected by this decision, as well as about 190 countries under the COVAX scheme. But what this really says that over-reliance on outside sourcing of vaccine results from the fact that Africa has little vaccine manufacturing capacity, and therefore the continent is put in a vulnerable position. Secondly, with regards to combating vaccine hesitancy and increasing public trust, this requires much more aggressive combat of misinformation through clear health promotion messaging and compelling media products. And finally, I'd just like to say, with regards to Africa's vaccine manufacturing capabilities, I think the African Development Bank stands ready with the Afro-Exim Bank. We have to strengthen advocacy to advance Africa's vaccine manufacturing so that Africa isn't reliant and Africa can have its own vaccines in the medium future. Thank you so very much.
I think that you have even outdone Dr. Ahmed in terms of sticking to time. Dr. Abubakar, I know you will do better than the 2 colleagues in keeping it brief. Over to you, Dr. Abubakar.
Well, thank you very much, moderator, but also I would like to thank to the organizers of this very important meeting, a more important Chief and former President Obasanjo, as well as other colleagues, distinguished guests who are participating in this. On behalf of the Director, Regional Director of WHO, Eastern Mediterranean region, I would like to congratulate African Union as well as the African CDC for their strong leadership and commitment actually to spearhead, what colleagues have said that, African problems and African solutions. And I think we as a WHO, we are well behind the leadership of African Union as well as the African CDC on achieving, the targets that's been set at the beginning of this pandemic. But I would like to highlight few things in relation to the main topic of this discussion, which is the coordination of the response in Africa. And I think, as you all know that, the COVID was an unprecedented challenge globally, but more so in Africa. And I would like to highlight few issues related to this challenge in which African countries and as well as many countries globally have really faced. In the early phase of the pandemic, when the first case actually was confirmed in China, but also the first case was confirmed in Africa, and that was in Egypt in February 14. Actually, there was a dilemma, and there was a lot of discussion how much information that African countries need in order to prepare for the potential outbreak. Because at that time, there was no pandemic, and the pandemic, when the Director General has confirmed the pandemic, the issue was, do African countries have enough information to prepare, but also to activate the response that's required? And it became a major challenge. And that's where the African CDC actually, as well as the WHO, come in handy to provide the required information that the countries can actually utilize and also put in action to really activate their response interventions into that. The Director General of the WHO, Dr. Tedros, since the first day of the pandemic until as of yesterday, one of the key messages that he really advocates is solidarity and cooperation at the global level, but at the continental level as well. And I would like to highlight few of these areas in which the Director General have repeatedly actually stressed that we as an Africa and we as this continent, these are the areas really we would like to coordinate among ourselves in the private sector, in the UN agencies, but also our partners within and outside the continent into that. The most important is the technical expertise that requires to address the response on this COVID. As Ahmed have said earlier, as well as other panelists and other speakers, I think it was evident that at the beginning of this pandemic, we didn't have enough knowledge for these new viruses, how to test, how to manage, how to contain the outbreak. And it became important for us to build the capacity of our healthcare workforce as well as other countries in order to have a well-developed human resources. And I think African Union as well as African CDC, with the support of WHO and other UN agencies, we played a very important role for us to ensure that we have a trained expertise to support the countries in Africa. And we have fulfilled the target of establishing the testing kits, the testing facilities, the clinical management network, as well as others. I think it took longer than expected, but at the end now Africa has the largest network of PCR tests as well as the sequencing capacity, and we need to do more to achieve the target. The second point I would like to highlight is the information sharing that I have mentioned earlier. I think there was a challenge within Africa, the countries, there was a little information sharing within the countries and also the cross-border collaboration, but it became very evident that as the pandemic started, with the leadership again of African Union, as well as the African CDC, as well as WHO, to actually enhance the information sharing between countries and also the expertise that countries need to respond to this outbreak. And I think that is what proving to be very effective, where we said that African problems actually is the African solution. And we really come out very strong cross-border collaboration where we really help each other to kickstart the response, even the countries that have not responded cases after 2 months of the 3 months when the pandemic was declared. Another important issues in which the previous speaker panelists have mentioned is the supply issues. And I think our Director General have repeatedly said that the procurement and distribution of supplies need to be adjusted actually. We cannot have what we call the medical supply nationalism as well at the beginning of this pandemic. And I'm glad that Africa Union, as well as Africa CDC, with the support of WHO, we managed to establish the supply chain management at the global level, but also in the continent, and we are able to meet the demand at the continent regardless of where it is. Again, we have not reached the levels that we would expect, but I think this is something that we collectively initiated, and we really need to build on in collaboration with the private sector. But what's more important is we really need to see that how Africans can produce their own supplies. As much as the vaccine that many colleagues have reiterated, we need to produce our testing kits, we need to produce our PPE kits, and we need to really promote the trade within African countries, so at least we can create the demand, but also we can meet and also procure the available supplies, whether it's from South Africa or Egypt, in Kenya, Ethiopia, and everywhere into that. Another important point I would like to reiterate is how to deal with the infodemic. It becomes very important for us in the African continent, as well as those of us who are dealing with public health, that in the social media plays very important role in disseminating in the wrong information and uncorroborated information. And it is the African Union, African CT, as well as other media outlets to deal with this infodemic. And we challenge that, and we coordinate it effectively across Africa as well as the global level, how we can deal with this misinformation, how we can provide our communities and our people the right information that they can prevent, that they can contain, and also they can protect themselves for these deadly viruses and infections. But again, I have to say that we really need to better coordinate as well with the social media and the related thing. And the lastly, Chair and Moderator, I think it is the issue with the genomic surveillance, in which, again, I have to congratulate Africa CDC for really establishing the regional network of laboratory with the capacity to sequence the specimen. But I think this is the area that we really need to invest, and we really need to put more money that we can at least have this capacity, and we need to better coordinate. And I have to tell you that, supplies, specimen that coming from Somalia now has been tested in Nigeria, and those coming from Sudan has been tested in South Africa. And that clearly shows that the commitment of the African CDC and also other private sectors to share the resources, but also the expertise. And WHO will stand by and support and complement the effort done by African Union as well as the African CDC. Thank you.
Thank you, Dr. A wide range of issues have been raised. I'm just going to field 3 questions to each of you and then give you less than 3 minutes to answer them. First, I think we've described both problems and solutions. A question has been asked, Dr. Ouma, that because we learned from HIV and AIDS that focusing on one pandemic almost exclusively poses challenges to the broader healthcare delivery system. So the question is, what threats do current COVID-19 responses, including vaccines and vaccination, pose to the broader healthcare delivery in Africa? Dr. Abubakar, you have described some of the missing things, but because I cut you short, what is Africa missing in the current response to COVID-19 pandemic? And then Ms. Atsuko Toda, there are gaps in the current vaccines and vaccination programs. Some of them have already been detailed by this panel. Can you think of any that the panel has not detailed? And then back to Dr. Ahmed, how is the recent halt on the Johnson & Johnson vaccines going to affect AU's recent deal with the company to bring in 400 million doses, as reported in the media? What steps and remedies being planned for such an unexpected turn? And then how do you harmonize strategies to eradicate COVID-19 in Africa when some countries, this is to you, Dr. Ouma, how do you harmonize strategies to eradicate COVID-19 in Africa when some countries, such as Egypt and Nigeria, have decided to fund research to find their own vaccine against the coronavirus? Will we really get a common strategy and response for the continent? This was from Pamela Kumba, who's with the SABC, who says also that it is certainly time to produce our own vaccines, But what are the chances that all African countries will agree to use only that vaccine that we produce? Can it also be exported to other continents? So what is the ambition in the production? Is it only to meet continental needs? And then last, we see the numbers, Ms. Toda, we see the numbers. However, if we look at the death rate in Africa in relation to years before COVID-19 pandemic, by what percentage have the death rates increased as a result of the pandemic? If the recovery rate among states are as high as 85% and above, why do we need vaccines with a 65% efficacy, Dr. Abubakar? There were a lot more questions. Unfortunately, as I learned in Malawi, they say time is jealous. It is nothing to do with CoDA. And I'm telling you that Dr. Monique, our vice chair, will confirm with you that time has a tendency to be ungovernable, especially when you are discussing Africa. So I'm going to ask, starting with our main speaker, who has 5 minutes, and then the respondents 3 minutes each, and then I'll introduce the chair of the next session. Can we do the responses? We will start, sorry, Dr. Oma, our only lady on the panel is going to leave soon. So I'm going to start with, and thank you so much for gracing this occasion. Please, we'll start with you and feel free to leave afterwards. Yeah.
Thank you so much for the ladies first policy. I really appreciate the question. I'll take the one with regards to the gaps. I think with regards to what Africa has been doing as a set of countries, as a region, has been tremendous. And in terms of the response to COVID, the resilience that's been shown, this is formidable. And there are things where you feel in the countries, for example, I stay in Cote d'Ivoire, I just came back from Nigeria, you are seeing around PCR testing some leapfrogging happening. Things, you know, the ways that things are getting done are really impressive. So when it comes to gaps, I think during COVID-19, as a community, we started to think about short-term, medium-term, long-term responses. Post-COVID-19, we really need to do the same. And with regards to the action plan around how do we put the ecosystem together? How do we bring infrastructure is expensive. How do we put policy together? Infrastructure, public, private, the action plan at different timings that need to pull together. I think this is the opportunity for Africa to show that it can do that. And so for me, it's not so much a gap, but again, an opportunity for the African continent to work together. Thank you.
Thank you so much. We were privileged to have you. So let me start with Dr. Abubakar, and then we will end with you, Dr. Oma, since you are our host, Ahmed.
Well, thank you very much. I think I will take the question that you're asking is, what are the missing the African response at this time? I think I should say that Africa have made a huge progress over time in adjusting the response and also scaling up the response. But I would like to mention 2 or 3 points. One is, one of the questions that you have asked, I think the participant asked is whether Africa has a common strategy. And I think one problem that Africa we have is actually that we have a common strategy agreed by the African Union, led by the African CDC. And if all African countries actually stick with that strategy that's been agreed, we could make some difference. And this is where the challenges come, where countries actually might decide to defer or to divert this strategy that's been agreed. And that's one of the challenges. The second challenge that I would like to raise is the decisive leadership and a commitment, not only at the national level, but at subnational level and community level. Remember that majority of the cases and deaths actually are occurring at the community level and rural areas right now because of the spread of the new variant in number of countries. We really need to have a commitment and also a stronger leadership at the peripheral level and at the community level. And we really need to bring those communities at the peripheral on board and at least push them to meet what needs to be done for the COVID response. Another important thing we really need to push is the overall health system. We cannot forget that, COVID pandemic or the response is within the framework of health system strengthening. We should not forget that we really need to tackle the problem of health system in Africa. If we do that, we will be better prepared, we will be better, prevent and also respond to any pandemic, not only for COVID, but other eventuality. And that's what we really need. And lastly, the resources that we really need to finance and to support the response strategy that we have agreed and that we would like to be implemented at national level as well as the subnational level. Thank you.
It's fascinating just listening. Dr. Omar, I'll just add half a question to you, which is, where do you locate initiatives such as Arua by public universities, initiatives by private universities, and Africa's small to medium enterprises in the ecosystem? And if so, how can they be effectively engaged? That's the broader African private sector, but specifically the small. And then the other half is half and half. Pastoralist communities, informal settlements, and other entities. We have traditional leaders that you and CoDA have ably brought today. What is your message to the Asama of Benin Republic, and of Benin, and also to Bishop Chahane and all the other faith leaders listening? How can they play a more effective role in the response that you are leading? And how can you coordinate better with them? Well, I said 5 minutes, but since you are the last speaker, maybe can I add just half a minute so that at least you answer that one? Daktari, over to you.
Thank you very much, Chair. And in the interest of time, I'll try and keep, because some of these issues will arise in the next session. Let me start with the healthcare delivery part. For sure, healthcare delivery has been negatively affected by the COVID-19 pandemic for different reasons, including the following. One is, at some point, it became difficult to actually access healthcare due to the lockdowns, particularly in the early part of the pandemic. There was fear of going to hospital because people fear they may get the virus when they go there. Our healthcare workers are few on the continent. So they were stretched because we had to repurpose a number of them to look after, particularly to work in the COVID-19 centers, special centers, while some who were exposed were then off work. And so the few numbers became even more stretched as a result of this. And this definitely affected the healthcare delivery very negatively. And finally, is resources are limited, and resources that had been allocated for healthcare had to be shifted to respond to COVID-19 because this is an emergency, and so some of those more routine work has definitely been affected. What needs to be done is for us to reorganize our healthcare system. As Abdul Nasser has said, we need to reorganize it. We need to invest in it better. You remember the Abuja declaration of 15%. We need to go there so that our healthcare systems can be able to be stronger and better prepared for outbreaks and pandemics like these. Johnson & Johnson, it was a pause in use of Johnson & Johnson due to concerns, valid concerns, resulting from 1 in a million blood clots appearing in some individuals who had received that particular vaccine, particularly women of a certain age. What we have said as Africa CDC is that the benefits outweigh the risks, and we must continue to monitor closely everybody who is receiving any vaccine, not just a particular one, but any vaccine. We must closely monitor what effects there may be, because remember, all vaccines have received emergency use authorization, simply because we are in a pandemic and we want to control it quickly, and some of the side effects could not have been known because the time used to monitor what side effects that may come has been relatively short. So what we have said is, one, we continue to monitor everybody who's receiving any vaccine. That is a concrete step. Second, we continue vaccinating because the benefits far outweigh the risks. And third, we explore other types of vaccines as they become available in the market. When we look at the issue of funding, and some countries doing research while others may not be doing research, this is part of our strategy being driven by local vaccine production. We need to have local vaccine production, and that can only be done if we invest in research, if we invest in facilities that can be able to actually manufacture vaccines for humans. And I'm not too concerned that there's some countries that have already started. That's a good thing, because we must begin somewhere. And we are engaging with all countries that have the capacity to manufacture vaccines, to do research for vaccines, and they will all come under the big umbrella of vaccine production, which we will discuss in the next session. In as far as where to locate within the ecosystem, this the last question, the last set of questions that you are asking. You know, we have a lot to do right now. We have a plan, as I will explain in the next session. We have a plan for vaccine production on the continent, where everything needs to fit within its own place and time. We cannot be able to get all the solutions at the same time. We are going to ensure that the ecosystem on the African continent is such that it is attractive for research, it is attractive for local manufacture of vaccines. And that is a plan that we are going to be sharing in the next few weeks, because we are right now just polishing it up. Message to our community leaders, our religious leaders, indeed the public, is that the solution lies with us. And we are the ones who can actually be able to ensure that we interrupt transmission of this virus. So let us use our podiums, whichever podium we have. If it is a podium of being a neighbor, if it is a podium of being a teacher, if it is a podium of being a religious leader, if it is a podium of being a health worker or being a business person, whatever, all of us have different levels of influence, and we must be able to sell that message that vaccines work, and that it is our behavior that allows for transmission to continue, and it is our behavior that is going to contribute to the transmission being reduced. Let us respect the public health measures, let us take our vaccine, and let us stay safe wherever that we are. I thank you, Chair.
Thank you so much, Dr. Thank you to my eminent panel, Dr. Abdinasar Abubakar, Dr. Ahmed Ouma, Ms. Atsuko Tora. I am most grateful for your invaluable input. The next session is going to be moderated by Engineer Mansour Ahmed, who's the Vice Chair and Interim Executive of the Bureau of African Business Council. Engineer Mansour Ahmed is the 10th President of the Manufacturing Association of Nigeria and the Chairman of the African Manufacturers Association. He's an Executive Director at Dangote Group. He has qualifications in mechanical engineering from Nottingham University and postgraduate in industrial engineering and administration from Cranfield Institute, now Cranfield University. He has over 40 years experience across many industries in both the public and the private sectors. Between 2008 and 2012, he was Pioneer Director General of the Infrastructure Concession Regulatory Commission. And before this appointment, he was Director General of the Nigerian Economic Summit Group, and where he had spent 15 years at the Nigerian National Petroleum Corporation. He has extensive interests and extensive experience in the private sector. We are in the safest of hands. But let me end with a small story I once shared with His Excellency President Olusegun Obasanjo. That in our traditional languages across Africa, they say, if you are going to make an agreement or a resolution with a lion to be vegetarian, you have to be sure that you will be the first vegetable that the lion eats. What we've been enjoined to do is to remember that when Africa deals with the rest of the world is not Santa Claus or Father Christmas. They have self-interest that they project, and those self-interests may not be African interests. The sessions that we've gone through have said African solutions to African problems. So let us also say African solutions to global problems so that we are able to benefit. Engineer Mansour Ahmed, I hand over the session to you. Wish you the best in your deliberations.
Thank you very much, Mr. Brian Kogoro. Let me thank you for the way you ended that session. I think you are in fact leading straight into this session. Let me first of all pay homage to my former president, His Excellency Chief Olusegun Obasanjo, a person that we hold in high esteem, not only in Nigeria, but across Africa. Let me also recognize Dr. Monique Bagangwa, the new deputy head of AU. And of course, let me recognize other excellencies here, and ladies and gentlemen. This session, I think, will indeed represent the apex of what has been a very profound and interesting discussion on the trajectory of Africa's response to the COVID pandemic. And indeed, in particular, the role that this institution, the CDC, has played in perhaps mitigating what could have been a very, very disastrous impact on our people and on our nations. And I think for this, bringing it together at this level and pointing towards not just the past and the present, but also the future, by looking at, okay, we have now been able to respond to COVID in what I think has been a very effective manner. Africa has done much, much better than many other regions of the world, except in responding to the COVID vaccine, to the COVID pandemic. But I think we need to go beyond how we have responded. We need to look beyond today to look at the future. What does the future hold for Africa? What should Africa be doing with the experience that we have gained, looking forward to the future? I think this particular session, therefore, is going to look at the prospect of production and supply and access of vaccines to Africa as a whole. And I believe that what the last moderator has highlighted, that it's not just, in fact, what should Africa be doing for Africa in terms of production and supply of vaccines, but also what should Africa be doing for the global community. I think this is really, in my view, the heart of the conversation that we should be doing. And we have a fantastic panel of discussions. We have presentations by two eminent scientists. We have already heard from Dr. Ahmed Ouma, and after he will now also speak, especially on this specific topic. And again, I think we'll see that CDC has not, even as it has focused on responding to the pandemic, limiting and mitigating its impact, it has not ignored the prospect of the future, the production and access, direct access to vaccines. After Dr. Ahmed has spoken, we will also have Mr. Thabani Mafosa, who is the MD country director at Gavi, the Global Vaccine Alliance that has done tremendously well in trying to, at least at the initial stage, ensure that vaccines are available to Africa, even in the light of the massive vaccine nationalism that we've heard about. After these two scientists have spoken, we'll also listen to responses from Evelyn Kibuchi, who is the Chief National Coordinator, Stop TB Partnership, and Ms. Saidon Nisa Said, who is the AU Interface Dialogue Forum Head. I cannot, because of the limited time, go into the detailed introduction of the backgrounds of these eminent people. So we'll go straight to Dr. Ahmed Ouma, the Deputy Director of Africa CDC, to give us perhaps an insight into what has been the effort in terms of vaccine development and access strategy for Africa. What has been achieved? What are we looking to going forward? And then we will ask Mr. Thabani to comment on the subject matter. Thank you. Dr. Ahmed, over to you.
No, thank you very much, Mansour, and good to see you, Sam Makbul. So I'll skip some slides because of time, and in any case, we've already seen the epidemiological updates in the previous slide. So now let me focus now on the issue around vaccine development. Last year, we held a big conference, and out of that conference, we one of the key outcome of that conference was a strategy for vaccine development and access on the continent. That COVID-19 development and access strategy has three main pillars. One is accelerating Africa's involvement in vaccine development. Second is ensuring access to sufficient vaccine supply. And third is to remove barriers to vaccine delivery and uptake at the country level. And I'll explain each one of these in a little bit of quick detail. The first is to look at how, if you look here, the first one is involvement in vaccine development. And vaccine development demands that you can be able to have specialized sites where you are going to do all the development and trials for vaccines on the continent. If we look at COVID-19 vaccines only, we have 14 trials in eight different countries that are happening on the continent, and we can be able to increase this depending on how we engage with vaccine manufacturers. So this is one of the ways of increasing a vaccine access, development, because if you're part of developing a vaccine, then it becomes easier for you to eventually be able to access that vaccine. Now, when we look at the second pillar, which was getting sufficient vaccines for the Africa's needs, the way to do that is in two. One is you must be able to have financial backing. And financial backing here we have in two parts. We have the COVAX facility, which is funded by partners and run by WHO and Gavi. And then we also have our own homegrown Afrexim Bank, who have put a promissory note that they will pay for vaccines for African countries, and then the African countries will pay back Afrexim Bank. So when you have this financial and political support, you're solid. You can be able to go out. And the second part of this pillar is looking for good deals. And what we have done as Africa CDC, Africa Union, through the African Vaccine Acquisition Task Team, is to go out and engage the vaccine manufacturers directly and get good deals out of that. You get a good supply to come quickly, and you get a price that is more or less the same as that is being offered to the COVAX facility that is being run from Geneva. So these two aspects of vaccine supply are extremely valuable for what we need to do on the continent. Now, why do we need to go out there and look for vaccines quickly? It is because we are a continent of 1.2, 1.3 billion people. And if we want to vaccinate 60% to be able to reach herd immunity, it means we are looking at about vaccinating 750 million people, and that ends up being about 1.5 billion doses if it is the two-dose regime. If it is the one-dose regime, then you're looking at 750 million doses. This costs money, and we are looking at about $10 to $15 billion to be able to procure this level of vaccines. Our needs are, as I've said, quite high because we are a continent of many people. And why do we need vaccines? We need vaccines because we want to open up and economic activities to continue, not probably as they were before, but at least for travel to become easier across the continent, and business can then be able to go up, because right now it is quite depressed, the business. If you look at the COVID-19 vaccine doses that have been administered as of last week, you will see the darker the color, the more the vaccination has happened across the world. And if you look at Africa's situation, it is literally white, because very little is going on in as far as vaccination is concerned. Part of the reason why we need to have our own way of accessing vaccines in a more efficient way. So we are lagging behind today in as far as vaccination is concerned. Now, if we look into the future, those who may be able, what are the projections in as far as reaching herd immunity is concerned? The more green it is, it means they will be able to reach herd immunity during this year. The more different the color, it means you're going into next year. Now look at Africa. With the current supply flow into the continent, we will not be able to reach herd immunity. We are looking at maybe the early part of 2023. And this poses a huge amount of problems to the continent, because it means that we'll almost be reaching a situation where the virus becomes endemic. And you don't want that to happen because of the rates at which it is disrupting economic activity on the continent. Three critical challenges in as far as COVID-19 vaccine in Africa is concerned. One is access. As I've shown you, we are having difficulty because those who have more money are actually buying it off from their own factories. We are seeing those who have the vaccines factories within their own countries, they are keeping it to themselves, vaccine nationalism, and this is proving very difficult for us in Africa. Second is the challenge of logistics. Vaccinating about the 1.3 billion people, 60% of 1.3 billion people would mean 750 million people. And if you're going to give them 2 doses, as I showed earlier, that is 1.5 billion doses of vaccine that you need to give. It is a big challenge because before we were only immunizing children and the numbers were relatively low, and the children are not born all at the same time. It is something that is progressive. But right now, we need to do it within the space of about 12 to 18 months. And it's a very huge logistical challenge, but we are tackling that with our partners as we plan. And third are mutations. The longer that we keep the virus circulating in the population, it will change. And we're already seeing different types of mutations. And those that are going to make life difficult for us are the ones that cause either more illness, are more transmissible, or are resistant to the vaccines that we know right now. So these challenges led us to call a conference on the 12th and 13th of April so that we see how do we expand our vaccine manufacturing capacity on the continent because of all the problems we are seeing with the current situation of COVID-19. Major outcome of the conference were 2. One is we launched a partnership of African vaccine manufacturing. And secondly, we put together very clear milestones of what we need to do. Now let's start and look at what the partnership looks like. This partnership really is a vision. It's a vision for the African continent to do its own vaccine manufacturing. And we want to make sure that we are accessing vaccines in a timely way. We want to ensure that we are having sustainable source of vaccines whenever it is that we'll be able to need them. This is the vision. And that partnership was launched by His Excellency Felix Tshisekedi, the current Africa Union Assembly President and Chairperson. And we are looking forward to ensuring that the partnership works. Indeed, on the day of the closure of the conference, 2 partnerships were already signed, one between the Africa Union Commission and the Coalition for Epidemic Preparedness Innovations. These are very key organization globally for developing vaccines. And I will not go into the detail of what those agreements say, but it's just to show you that the partnerships are already working. And secondly, Afreximbank and the Africa Finance Corporation also signed an agreement to ensure that we have access to financing. Now, if you look at the current situation on the continent, I think President Orama already touched on this a bit. Today, we are only locally manufacturing 1% of our vaccine needs for the human being, that is. Where we want to go is that by 2040, we want to do 60% manufacturing on the continent, and we'd only be importing about 40%. This will give us a very big step forward in ensuring that we have some sustainable sources of vaccines on the continent. The second major outcome was a framework and a very clear milestones. I'll not go into them in detail, but suffice is to say that we want to start with the simpler things to do, and then we go into the more complex things that need to be done. And we have mapped that we can be able to achieve these in a very short time because others have already done it. We'll not be starting from scratch. We will be starting from a place where others have already stepped, and with correct partnerships, we can be able to do that. What is our ambition? Our ambition comes into 5 big blocks. One is setting the agenda and coordination. That will be Africa CDC and the Africa Union. We have regulatory strengthening, and you will recall that we have the Africa Medicines Agency, that is a protocol, a treaty that is currently being signed on by Africa Union member states. As soon as the treaty becomes, this agency becomes a reality, it will take up the regulatory part on the continent. Access to financing, you see already the 2 big institutions, Africa Finance Corporation, Afreximbank, have already signed an agreement. And of course, we have our very own Africa Development Bank. These institutions can be able to provide the resources we need to set up vaccine manufacturing on the continent. Infrastructure, we are going to use what we have as we improve on it. And our regional economic blocks are going to be extremely useful in ensuring that we can regionalize these facilities rather than each country doing on its own. In as far as experts is concerned, we have a good base as it is now. Our universities and research institutions, the vaccine manufacturing companies, you see in the media how Africans are a very key part of many of the vaccines that are being coming into the market out there. We want to bring them back home so that we can be able to ensure that we have a solid base of experts. I will skip the next steps and go to the key takeaway that I would like people to remember, that vaccines plus vaccinations is equal to saved lives. If you don't have access to vaccines, then you cannot be able to save many lives. If you have access to vaccines and you don't have access to an effective way of vaccinating, then you also cannot be able to save lives. So we must have both these in place, a source for vaccines and an effective system to be able to vaccinate Africans on the continent, and that way we will be able to save lives. These are some of the things that we have done as Africa CDC and the Africa Union in putting together the COVID-19 vaccine and generally human vaccines on the map, on the priority list, so that tomorrow, when another outbreak, another pandemic comes, we are better prepared and we are more ready. I thank you, Chair.
Thank you very much, Dr. Ahmed. Clearly, a very perhaps robust target we are setting ourselves. I think we can now ask Mr. Tabani Mfosa, and given your experience with the efforts that Gavi has been making over the past several months, would you say that trajectory that Dr. Ahmed has highlighted is overambitious? What are the key challenges to being able to execute that strategy? that has been highlighted. Mr. Tabani Nafosa, over to you, please.
Thank you very much, sir. I hope you can hear me okay.
We can hear you very well, thank you. Please go ahead.
Thank you. Warm greetings and to all your excellencies that are in this meeting, ladies and gentlemen, all protocols observed. I really want to appreciate this invitation from Africa CDC and the work that they are doing. And I think a critical question that you have asked me here, I do have a presentation, but I want to begin with where you ended, which is the question. I really think that Africa must have a proud moment. A proud moment because the Africa CDC really has been one institution that has been established in an extremely timely manner. But one institution that also has not wasted a crisis. It has taken advantage of this crisis and really made sure that it uses its position to create a platform, to mobilize and to bring others on board as much as is possible. We are talking about vaccines today, but you will remember that before we got to vaccines, we actually had the issue of PPE. And you would have seen how Africa mobilized itself on the issue of PPE through the medicines supply platform, the Africa Medicine Supply Platform. And I think this is just one example of how quickly Africa is coming of maturity and being able to organize itself. As I listened here today, and I was hearing a number of speakers, I really wondered what is the new perspective that I will add to this conversation, because the real issues that matter have been identified and have been well articulated. But I will still add that coming from the COVAX facility, this problem still remains a global problem. Africa must cover its base. Africa must do its part. But I think that Africa must continue to do its part in coordination with others. It is important to note that resolving this crisis in any part of the world without resolving it in Africa will not actually resolve it. But also resolving it in Africa and not resolving it in other places will not be sufficient. I still don't see my slides. I'm just trying to check with the person who was supposed to help me with my slides. Are you able to project them?
Yeah, I think you are seeing your slides now.
Thank you so much. I could have gone on the cuff, but they are a good guide, especially because we are running late. I think one of the important things that we really have seen is that a solidarity approach is extremely important. At the beginning of this crisis, a number of institutions that have been mentioned here have come together to form COVAX. And when COVAX was formed, it was with a clear focus of making sure that there is equitable access to vaccines. Dr. Ahmed really spelled it out well. It is important to access vaccines, but in the context of Africa, I would say that it is also important to make sure that the health workers who need to administer those vaccines are in place. We do know that we have a constraint, and it's a constraint that we need to respond to. Thirdly, everybody else spoke to the issue of vaccine hesitancy and vaccine confidence. And so I normally refer to those as the 3 V's: vaccines, vaccinators, and the vaccine confidence. Let's go back, Wambui. Let's go down a bit. Next slide. On the first slide, I wanted to say that Dr. Ahmed referred to the AVAT that was formed by the Africa Union. The COVAX leadership, that is my CEO, Seth Beckley, and myself, and my fellow MD, Aurelia Nguyeni, who's the head of the COVAX facility, have been meeting with the AVAT facility, the AVAT task force, to make sure that we are well coordinated in terms of the inflows of vaccines that are coming to Africa. Strive Masiwa has pressed us very hard that we must give visibility to the pipeline and to the types of vaccines that are coming to Africa, so that we can be better coordinated and we can give our countries a lead time to plan. We have established the COVAX AMC, which is 92 countries globally, low and middle income countries. And of those countries, we have a target of raising 8.2 billion. We have raised now just shy of 7 billion to support these efforts. Next slide, please. We can see the number of countries. The COVAX facility has 191 economies. And of these, we have 92, as I said, of eligible economies. And it is important to note that that blue, a significant proportion of it does sit in Africa. So our coordination with Africa is a non-negotiable because a lot of the ODA that we have has got to be coordinated and contribute to the 60% target that Dr. Ahmed just spoke to. Next slide, please. In terms of the vaccines that are in our stable, it is also important as I speak about these vaccines. So the deals that we are looking at, they are broken down there, as you can see. Legally binding deals for 2021 is 1.3 billion, but we are looking at up to probably 3.5 billion doses that may be identified. Signed agreements involve about 7 of those manufacturers that you can see. One thing that is important here is that we have been coordinating a lot with Africa to make sure that even on pricing, Africa gets a favorable pricing. It's important to note that the economies of scale and the demand pool is important. And so we have got to be coordinated. In terms of the supply forecast, as you can see, this is the supply forecast in the course of this year. With the disruptions of supply that we have seen, we are having a very tough April and May, but we hope that we will begin to see numbers going up in the coming months. Next slide, please. Dr. Tedros has referred to this issue that everybody has spoke about very well, which is the infodemic and the type of information that is passing through. And I think that Dr. Ahmed really laid it out well. Each one of us with the platform that we have as a neighbor, as a brother, as a friend, as religious leaders, how can we make sure that the information that comes into our hands is passed responsibly, and we assure that the information that we pass on is well vetted and we don't just pass information without screening it and asking the right questions, whether it is true and it is helpful. Next slide, please. To this end, we are working with a number of our partners to make sure that there is systematic listening at a community level to understand what are the concerns, whether it's fear or it's facts, what needs to be provided. But we are also thinking about how the health workforce, the frontline health workers can instill the confidence that is needed. I'll pass on this slide pretty quick, given where we are. Countering vaccine nationalism is our biggest challenge and probably one of our biggest. When we started at the beginning, all of us said the enemy was the virus, but it seems like the enemy has become a house that is divided, a house that does not think of the other, and always thinks for oneself first before others. But the mantra that we've been going with, and where I began, is that unless all of us are vaccinated, or a big proportion of us are vaccinated, then the progress that we seek to make will not be made. And I really think that a vaccine multilateralism and solidarity are the key ways that we need. To end with answering your question again, I believe that the vision that has been laid by Africa CDC and the AU is the correct one. And it is one that we all should be rallying behind. It is not without challenges because Africa CDC, not Africa CDC, but the AU at large, when it gets to vaccine manufacturing, it will be getting into a space that has many players. How is it going to make sure that it remains competitive? How is it going to make sure that the prices are affordable and they can take this to scale? And those are challenges that we are committed to work with them in the course of the coming years. Thank you very much.
Thank you very much, Mr. Mafosa. I think that's clearly lays out some of the key challenges that we must address going forward. And I have now two panelists that will respond to these presentations. I start with Ms. Evelyn Kibuchi, who is the Chief National Coordinator, Stop TB Partnership. And I would like Ms. Kibuchi to take a look at the trajectory that has been discussed over the past several hours and the future we're looking at, that is towards development of vaccine manufacturing and increasing access to all Africans. Now, you obviously have been dealing with perhaps not quite the same, but a similar kind of infectious disease in TB. And one of the key issues that have been highlighted have to do with the needs to put together partnerships that work. And I have no doubt that in developing partnerships for TB, you will have developed insights that can be brought into this matter. So first, one question I want you to address is what new partnership arrangements should we propose that will accelerate the coordination, the collaboration that will lead to vaccine development of vaccine manufacturing in Africa. Secondly, I think we have seen a lot of innovations in what has been done so far. Innovations in logistics, such as the African Medical Supplies Platform, innovations in financing, such as COVAX itself, as well as the Afro-Exim Bank initiative, and indeed innovation even in partnership. So what, in your view, are going to be the key approaches to the strategy that will lead us to quickly expand access to vaccines through to a large extent, domestic production of vaccines. Thank you. Ms. Kibuchi, are you there?
Thank you. Thank you very, very much.
Thank you.
Say Chief Olusegun Obasanjo, former president of Nigeria. Fellow panelists, distinguished guests, all protocols observed. Thank you so much. When the first case of COVID was reported, that was last year, so all stakeholders swung into action. These included scientists, policymakers, heads of states, researchers. They all swung into action, but in their wake, they left behind two very important stakeholders. And these are the communities and the civil society, or what I would call the advocates, who are very key to complete the spectrum of the stakeholders that have been responding to COVID. And what did this lead to? One, it led to vaccine illiteracy because of leaving out these two key important stakeholders. And this has led to vaccine hesitance. And number two, leaving out the civil society, or what I would call advocates, also has led to inadequate response to COVID. So what is required? First of all, we need to involve these two stakeholders in a big way. And I want to start with the civil society organizations and their role in ensuring that there is access to COVID vaccine, and that there is also what you're promoting, the local manufacturing of vaccines in Africa. The role of civil society organizations in advocacy: one, they do policy environment. We do advocacy also for resource mobilization. The civil society also play a very key role in doing advocacy around human rights, and also mobilizing other key players that need to be involved in in vaccine response. And maybe the question that we could ask is, do we have a strong civil society organizations? Do we have the capacity? And I'll say yes. Going by my experience in other disease response in Africa, in African region, for example, TB, HIV, and malaria, we have very robust and vibrant civil society organizations that have been very key in doing a lot of advocacy for resources, for research and development, for policy environment. But in the COVID response, I strongly feel that there are gaps in the capacity of the civil society and also the communities to respond to this. So what needs to be done? One, we need to strengthen the capacity of these two institutions in COVID in the vaccine. We need to provide them with space in the decision-making processes. Like I mentioned, were left behind at the beginning of the COVID response. We need them involved in the entire spectrum of the vaccine development and in research development. I know previously we bring some of these stakeholders when everything has been done and has been brought to the table, but we need to involve them from, for example, in the research. We need to involve them from the concept development to the research to the implementation. Whenever there are gaps, then we are going to call on them to engage them in advocacy. We also need to strengthen again their capacity. Let me first mention about the advocacy component. So many issues have been raised, beginning with the need to address the vaccine access inequalities, which has been one of the biggest elephants in the room. We have been talking about technology transfer, where we want access to technology that can help us roll out vaccine manufacturing in Africa. We have been talking about TRIPS flexibility And we've been talking about the financing for rolling out vaccine development in the African region. This can only be addressed if we have a very strong body of advocates. And I say this from experience from the other diseases that I've been dealing with. We need to have a very strong body of advocates who are knowledgeable about the vaccine development so that they can bring in their strong voices in all these issues that we are struggling with. Finally, talking about the vaccine literacy. The previous presenter has talked about the vaccine hesitance, and there are so many questions that have gone unanswered regarding the vaccine. I remember receiving an email from somebody who told me he's on TB treatment and he wants to get the vaccine, the COVID vaccine, and he wanted to know, are there any are they going to counter each other? So there are so many questions that regarding the vaccine that have gone unanswered. And we need to have a framework to address these myths and these misconceptions and also create more awareness around the vaccine. Again, we need not forget that even if you're going to have the vaccine is only going to address the more severe forms of COVID. Therefore, we will still need to continue with the public health interventions, which include the conventional washing of hands, the masks, the washing of hands and masks, and the social distancing. So again, we need to continue promoting these interventions, and we need the communities and again the civil society as partners in rolling out all these. Again, to address the vaccine hesitance, we will need to invest in testing, in diagnostics, so that we can also promote the uptake of the vaccine, the uptake of vaccine. So in ending, what I want to, you asked me about the approach, the innovative approach that we need to adopt. So besides now the communities and the civil society and advocates, we also need to adopt a multi-sectoral approach where we take the COVID issue as everyone's problem. We need to bring at table the other sectors, not just the medical sectors. We bring the Ministry of Education, the Ministry of Transport, everybody that has a role within their core competencies to address the vaccine, the COVID issue. And I want to end and say the successful address of COVID in African region, and also the successful rollout of the local manufacturing of COVID will only be brought about by a very strong engagement and involvement of the civil society body and a very informed body of civil society and engagement of the communities who are the final beneficiaries or consumers of the product that we want to bring on board. So with that, thank you so much and look forward to seeing the vision achieved. Thank you.
Thank you very much, Evelyn. And I think that reference to the need to engage the communities brings us right to the doorstep of Sedun Nisa Said. You're the African Union Interfaith Dialogue Forum. And I believe, especially in Africa, interfaith dialogue must be literally the entire community, because Africans are all in some way belong to one faith or the other. And this interfaith dialogue is a major platform for bringing people together, for sharing opinion and sharing commitment. Mr. Said, from your perspective, what do we need to do to ensure that even if we are able to develop vaccines in Africa, that the propensity, which is common in Africa, to prefer foreign imports will not, in fact, defeat the purpose? How do we orient our people to actually, commit to taking the African vaccine, even before we seek ways to export it to other nations? Ms. Said? Hello?
Thank you very much.
Good.
I think
You say I can't hear you. Are you muted?
No, I just unmuted myself. Can you hear me?
You are muted, Ms. Said. Can you unmute your microphone?
Can you hear me now?
Please unmute your microphone.
We can hear you. I think the problem may be on the facilitator.
We can hear you, yes.
Okay.
I think Suad is trying to help me out here. I can't hear her at all.
Oh, okay. No, we can hear her. And we can hear you too.
Now can you hear me?
I do hear you. We are hearing you. You may want to proceed. Proceed, madam.
Yes. Due to time, I have to. I think vaccination is one of the great intervention of all time. And we know that vaccination has saved countless lives and improved the health of people all over the world. I think as Africans, we need to begin to trust our African CDC and everyone that's involved in the manufacture, the lobbying, the implementation of the vaccine that we are to use. I think for a very long time, we've always waited for foreign medicine, and we disregarded our own homegrown local medicine or any other aspect. So for us as people of faith, disease prevention is one of the goals of the public health, and vaccination is an important component that assists in facilitating this goal. So there are concerns in Africa about the vaccines. Many have been halted, some suspended, some gone back. But I think from the presentation from our two speakers, we need to do everything in our ability to look at how we promote, lobby, advocate for Africa to be a united front, so that anything that is produced in Africa will be the best that we as Africans will want to use, and not look at foreign and other countries for us to buy. And as we've seen that the cost of the vaccine is tremendous, and we need to look at how we can put all our resources together to look into this. Yes, all the speakers have spoken about many gaps, and I think these are fears among the African citizen, the people in Africa. And if you hear of concerns and gaps, then they become very agitated. If there is these concerns and gap, are we going to be able to take the vaccine that is produced in our own continent? And because of these are many challenges, but as the faith community, we have a role to play in looking at how we go about using whatever is formulated in Africa for Africans, and the solution lies with us. And with COVID, the challenges have been absolutely tremendously disheartening. And I think with the vaccine, we see there's hope. And there is a need for us to persuade our citizens, and we need to build this trust among ourselves as the leadership of the NGOs, the the governments, the faith-based sectors, etc. So we'll be able to come up with tangible solutions to whatever we want our continent to have. We know that religion has been a force in human history, and that is the same right now. As the moderator mentioned, that about 90% of all of us in Africa belong to some faith. And I think for the sake of every one of us, for the vulnerable people, those that are suffering during these crises, we must explore ways to address and bridge the divide between those who fear and doubt a vaccine and those who support this path to COVID solution. So there's in the manufacturing and in the social mobilization, there's lots of work to be done that we need to use our religious leaders, faith-based organizations, theologians, scientists, public health specialists. We all need to join force with our politics and our community leaders and see how we can build the needed trust and respect in carefully vetting vaccine. There is no doubt that religious support can and will play a role in this process. That a part to create the widespread trust we desperately and solely need if we are to beat the horrible common threat. What we need to look at is we need to preserve religion, we need to preserve life, we need to preserve progeny, we need to preserve intellect, and most of all, we need to preserve health. Interestingly, vaccine will fulfill all of these objectives that we have. And also as people of faith, we need to contribute towards the sustainable development goals on health and how to provide access and vaccine for all of the people. I will leave you with the parting remarks of the golden rule. We should do unto others as we would have them do unto us. Thank you very much. Hello. You muted.
Hello, can you hear me now?
Yeah, yeah.
Yeah. Hossein, thank you very much for that insight, and particularly for the comments at the end, which indeed is a fitting end to the conversation. I understand we have run out of time. In fact, we are way past the initial planned time. So there may not be time really to ask questions. I think if Dr. Benjamin Dudel Baye is around, I would pass this to him. I will pass the floor to him to wrap up the whole conversation. Benjamin, are you around?
I am around, Your Excellency. No, thank you very much, Your Excellency. I don't have the presentation to wrap up, given the late time now. Excellencies, distinguished participants, ladies and gentlemen, all protocol observed. We have come to the end of day one of the virtual dialogue series on Africa's response to COVID-19 and equitable access to vaccines and vaccination. I would like to extend our special thanks to His Excellency Olusegun Obasanjo, former President of the Federal Republic of Nigeria and Chair of CoDA Board of Directors, for taking the lead in organizing this dialogue. I would like also to thank all dignitaries, traditional and faith leaders who have spoken and shared their perspective on COVID-19 vaccine. I am inspired by our consensus on the need to deliver vaccines for Africans. By doing so, we should strengthen our capacity to manufacture vaccines in Africa. We cannot depend and rely on others for our health security. As a matter of fact, COVID-19 pandemic revealed the shortcomings of our continent in vaccine manufacturing. The fruitful exchanges of views and ideas during this dialogue will help us improve our processes, promote accountability at all levels, and strengthen coordination. It is also an argument for the continuation of such dialogues. We look forward to a time when relevant stakeholders can exchange views that can improve lives and livelihoods in Africa. Looking forward to another fruitful moment of exchange with you all tomorrow. At this end, I wish you all a restful and quiet evening. See you tomorrow, and the session stands adjourned. Thank you so much.
Thank you very much, Benjamin. And I now return you to Swad for closing remarks, if any.
Thank you, everyone. No, I think Benjamin closed the meeting for the first day. We're going to resume tomorrow, and we will start actually by getting into the details of what the last two presenters actually said. We do hope to see you all again tomorrow. We thank you. Thank you, Excellency, Deputy Chairperson, for being with us all the way to the end. We do appreciate your presence and all your support. Thank you, everyone. Good night.
Thank you and good night.
Bye-bye.
Thank you.
Thank you. Thank you.
Good night, Your Excellency.
Thank you.
And thank you.
Thank you, Dr. Mansour. Thank you, Prof. Arthur. Thank you, everyone.
Thank you. Thank you.
Thank you. Bye-bye.